Hi, my name is May Willis, and I'm a registered nurse. So it is very interesting to consider the current image of the nursing profession in response to the coronavirus pandemic, which kicked off, as we know, in 2020. But 2020 has become the year of the nurse. Nurses are now described as the great heroes who are the frontliners in the fight against the coronavirus, and this is worldwide. We are now center stage. We're in the spotlight, and people are looking at us. They're paying attention to us. We made Time magazine last year. Starbucks gave away a free month of coffee to specifically nurses. And now consider the release of this vaccine and this platform that nurses have. Nursing has for a long time been considered the most trusted profession, and now being center stage, with the release of this vaccine, more and more nurses are actually video recording or taking pictures of themselves receiving the vaccine, and people are paying attention because there's a lot of fear regarding this vaccine, but people are paying attention to nurses. In this article that I chose, in 2018, the American Nurses Association described nurses as ones who inspire, innovate, and influence. We are at the heart caregivers. Our education has vastly expanded. We now have varying levels of education ranging from associates to bachelor's to master's to even doctorates level. Regardless of all of these advancements, we are still portrayed in a negative light. We're portrayed as handmaidens. Consider shows like Nurse Jackie, Ratchet, One Who Flew Over the Cuckoo's Nest, kind of uncaring, immoral even characters. And not to mention the sexy nurse Halloween costume that should just be abolished. I really like what our doodle guest speaker, had to say last week when she said that nurses make up the bulk of the medical profession. And if you want to change medicine, you have to change nurses. Huge light bulb. So nurses now have the ability to sit on boards, shape, and influence policy. We can literally be empowered change agents within the field of medicine. Look at some of the nurses living in areas like California who are creating unions to create positive change in those areas. We have several generations of nurses, from baby boomers to Generation X to millennials. In 2014, the Department of Labor stated that 90% of our profession was composed of women. Regardless, we're still kind of portrayed in a negative light. Regardless of these negative, misguided images, the mission of nursing remains the same. And that is, we are advocates who critically think, and we are rooted in ethics and holistic care. We are the most trusted profession, and we are the angels in white. We are the heroes. However, we can be negatively portrayed in these media outlets. So how can we change our image? We help shape our image by how we represent ourselves in our nursing profession. And this even goes to the way that we represent ourselves in social media. Other ways that we can help shape or maintain the image of nursing is hold nurses accountable for bullying and incivility behaviors. We can post, circulate, and advertise professional accomplishments. We can contribute to the community by writing health-related articles. We can speak to civic and community groups about what nursing is and does. We can teach and mentor nurses on how to validate all they do with documentation and active involvement. These are some of the very few ways that this article has outlined the things that we can do to help maintain the image of nursing in today's world.